And now I think it's time to move to the third presentation, and will be Professor Luo from the Chinese General Hospital. And Professor Luo is going to talk about thyroid, the application of contrast enhanced ultrasound in thyroid lesion. Please, Professor Luo.
Hello everyone. I'm Lo Yikun from Chinese PLA General Hospital. I'm very pleasure. I'm here from some experience with contrast enhancement ultrasound in the thyroid. My title is Application of Contrast Enhancement Ultrasound in the Diagnosis of Thyroid Cancer. As we know, the thyroid cancer is the most common endocrine malignancy. The incidence of detected thyroid cancer has been increased worldwide. In China, it appears to be the fastest growing cancer nowadays. So generally, conventional high resolution ultrasound can distinguish most benign and malignant thyroid nodule according to the ultrasonic characteristic. However, the overlapping and similarity of some ultrasound appearance make it difficult to distinguish benign and malignant nodules. For example, this cancer looked like benign adenoma, and this benign disease looks like. So a low mortality is required to improve the diagnosis ability of thyroid cancer. CEUS can display the microvessels in tumor as well. Previous studies and our work showed that CEUS is good assistant method for diagnosing thyroid nodules. Its applications in thyroid include the follows. 1. Assessing the composition of nodule is cystic solid. 2. Diagnosing the nodule is benign or malignant. 3. Guiding the targeted biopsy. 4. Evaluating the ablation results of thyroid nodules. Now, let us see the first case. A hyperechoic nodule with ill-defined margin. Regular shift and possible tiny echogenic foci was found in the right lobe of thyroid. Now, low blood flow signal was found in these nodules. Each conventional ultrasound feature are suspicious, but low enhancement was seen in this lesion by CEUS. Here. The FNA result showed that the lesion is nodule goiter with hemorrhage. This case indicates that enhancement ultrasound can reduce the unnecessary biopsy. The diagnostic method of CEUS in thyroid disease include enhancement patterns and time intensity curve. Solid thyroid nodule can display as low ESO and high enhancement, and 17.4% of cancer with suspected ultrasound appears show the low enhancement. If low enhancement pattern was regarded as malignant, the sensitive and specific and accuracy of CEUS were respective 81.4%, 73.6%, and 76.5% for the diagnosis of thyroid cancer. The extracapsular extension of thyroid tumor can be evaluated by CEUS. Here. And the detection rate by CEUS is higher than conventional ultrasound. The aggressive of thyroid cancer is okay. Let's see some cases. Thyroid nodule was found in annual physical examination and no related symptoms. We can see a mass with maximal diameter of 3.2 centimeter. Lobulated margin and some small cystic region on ultrasonogram. The appearance is similar to some adenoma, maybe it's benign. However, high enhancement with some irregular perfusing detect area were found on the contrast ultrasound, and an irregular high enhancement ring surrounding the mass was displayed. So, CEUS result is malignant. the final pathology is PTC without cervical lymph node metastasis. This is a woman, 48 years old, a hyperechoic nodule with a maximal diameter of 1 centimeter was in the thyroid lymph node. Internal heterogeneous low enhancement and peripheral marked high enhancement area were showed by conscious enhancement ultrasound. The thyroid capsular on CEUS is incontinuous. The final pathology results showed that PTC with cervical and lymph node metastasis. This is another patient, is a man with 58 years old. Marked hyperechoic mass with yield-defined margin. Macro and micro calcifications covered the most areas of thyroid gland. Marked heterogeneous high enhancement pattern with many irregular perfusion defected areas was showed on CEUS. The enhancement lasts long time. The final pathology is anaplastic thyroid carcinoma. And with lymph node metastasis. Contrast enhancement ultrasound can also be used guided the targeted biopsy in the node of thyroid, which could improve the satisfaction rate of sample. In this case, conventional ultrasound guided biopsy can't get a good issue. The issue is incomplete and has mucus. So we used contrast enhancement ultrasound to guide the biopsy, and then the complete tissue was obtained from the central area of lesion. The central area is high enhancement showed by CEUS. The pathology of this case was PTC. CEUS can exceed the tumor is active or necrosis. So, outcome of tumor after ablation can be evaluated by CEUS. Now, let me show you a case who acted radiofrequency ablation in our department. This tumor is micropathy confirmed by biopsy. The tumor's maximal diameter is 5 millimeter. Is 5 millimeter. And it with several micro calcification. Here. Very small lesion. CEUS before radiofrequency ablation showed heterogeneous low enhancement in this nodule. This strong echo during radiofrequency tumor was evaluated immediately after RF. During the follow-up, we can see the ablation room was smaller and smaller until it finally disappeared. So CEUS is good for diagnosis the nodule. So in conclusion, in the patient with suspicious ultrasound characters, CEUS is very good for distinguishing the thyroid nodule. For example, CEUS can reduce the unnecessary biopsy. CEUS is very good method to evaluate the efficiency of ablation in the thyroid nodule.
Thank you, Professor Luo, for your kind and very complete presentation about the possible application of contrast-enhanced ultrasound in the characterization of thyroid lesion. And let me share my webcam. And yes, and there is no question from the audience. I encourage the audience to provide some question if you have them. From my point of view, let me ask you, regarding the ablation assessment by contrast-enhanced ultrasound. I mean, when you use contrast-enhanced ultrasound to assess the outcome of ablation in thyroid nodule, you said how long after ablation you perform contrast-enhanced ultrasound? Just immediately and that's it, or do you repeat 1 week, 1 month after treatment? Could you clarify this point, please?
After ablation, the nodule of thyroid, the patient immediately we can 1 month, okay, 1 month, 3 months, 6 months.
All right. So you assess immediately and after 1, 3, and 6 months. And if you see some residual enhancing tissue at the periphery of the nodule, you repeat the ablation. Is it right? Did you hear my previous question? Did you hear? I mean, you said that you assess by contrast enhanced ultrasound the lesion immediately, 1 week, 1 month, 3 months, and 6 months after treatment. And my question is, when you repeat ablation, when you see some residual enhancing tissue at the periphery of the ablation zone, is it right? When you see some enhancing tissue, you repeat the ablation, is it right?
Yes. Here I will show your slide. CEUS can assess the tumor is active or necrosis. So after ablation can be evaluated by CEUS.
Yes. So it's clear. Now you can assess, and of course this is a benign hypervascular lesion.
Yeah.
So when you see some residual enhancing,
yeah,
you repeat ablation immediately. When you see residual enhancing tissue, you immediately repeat ablation, or you complete the previous ablation, I think. Is it right? So it is to guide your treatment.
This patient, the biopsy was performed 3 months after radiofrequency ablation. The hepatological result showed no cancer was found. 3 months after RFA, and
yes. So you have a yes.
3 months after RFA, and shows no cancer.
No cancer. Okay. Okay. Let me ask you another crucial question. What is the key findings in malignant nodules? The second application you described was the characterization of thyroid nodules to differentiate benign from malignant nodules. Since both benign and malignant nodules can be hypervascular on arterial phase, what is the key findings to differentiate benign from malignant nodules? What is the most important findings? Is it the washout? Is it the rim-like hyperenhancement?
The time of washout.
The time of washout.
Yeah. And it's not important. The intensity is very important.
Is there any time cutoff in the washout? What do you think with early or late washout? What do you mean? Is it before 20 seconds or 30 seconds?
It means the intensity of the nodule when CEUS, the intensity is very important, but the watch time is not important.
Is not important. Okay.
Yeah.
All right. So I don't think there are some questions from the audience. I don't see any further question. So I think we can conclude this web seminar. And let me thank, of course, the European Federation of Medicine and Biology for organizing to have organized this web seminar. And let me thank all the speakers for the very nice presentation, especially the wonderful image they show us, really wonderful. And thank you everyone, and also the audience for the kind question they provide to us. Thank you so much. Thank you to everyone.
Thank you.
Thank you.